Maternity question 2. 9. A client in the prenatal clinic asks the nurse about the delivery date. The nurse notes that the client record indicates that the client began her last menses on March 7, 2005 and entered the menses March 14, 2005. Using Nagel's rules, the nurse would tell the client that the estimated date of birth which of the following: 1. January 14, 2006, 2. December 21, 2005, 3. December 14, 2005, 4. January 21st, 2006. The correct answer is 3. December 14, 2005. 10. A nurse in the labor room is monitoring a client with dysfunctional labor signs of fetal or maternal compromise. Which of the following assessment finding would allow the nurse to compromise? 1. Persistent non-reassuring fetal heart rate. 2. Maternal fatigue. 3. Progressive changes in the cervix. 4. Coordinated uterine contraction. The correct answer is 1. Persistent non-assuring fetal heart rate. 11. A clinic nurse is performing prenatal assessment on a pregnant client. The nurse would implement teaching related to the risk of abortio placenta if which of the following information was obtained on assessment? 1. A client has a history of hypertension. 2. The client performs moderate exercise on a regular daily schedule. 3. The client is 28 years of age. 4. This is the second pregnancy. The correct answer is 1. The client has a history of hypertension. 12. A nurse is assigned to care for a client with hypotonic uterine dysfunction and signs of shower labor. The nurse is reviewing the physician order and would expect to note which of the following prescribed treatment for this condition. 1. Medication that will provide sedation. 2. Increased hydration. 3. Oxytocin infusion. 4. Administration of tocolytic medication. The correct answer is 3. Oxytocin infusion. 13. A nurse is using Nagel's rules calculate a pregnant woman estimated date of delivery. The woman tells the nurse that her last period began June 17, 2005 and ended 6 days later. The nurse would compute the estimated date of delivery to be 1. March 10, 2005, 2. March 15, 2005, 3. March 24, 2006, 4. March 29, 2006. The correct answer is 3. March 24, 2006. 14. A nurse is performing an initial assessment on a client who has just been told that the pregnancy test is positive. Which assessment finding would indicate that the client is at risk for preterm labor? 1. The client is 35-year-old primigravida. 2. The client is 20-year-old primigravida of average weight and height. 3. The client's hemoglobin level is 13.5 G per DL. 4. The client has a history of cardiac disease. The correct answer is 4. The client has a history of cardiac disease. 15. A nurse in a labor room is preparing to care for a client with hypertonic uterine dysfunction. The nurse is told that the client is experiencing uncoordinated contractions that are erratic in their frequency, duration and intensity. The priority nursing intervention in caring for a client is to 1. Monitor the oxytocin infusion closely. 2. Provide pain relief measures. 3. Prepare the client of an amniotomy. 4. Promote ambulation every 30 minutes. The correct answer is 2. Provide pain relief measures.